The Libido Doctor is in.
Hello and welcome to Libido Doc. I just want in this video to touch a little bit about erection and orgasm in men. Erection is the filling of your male organ with blood to make it harder, stronger, larger, longer, so you can actually hit the target. The target is the penetration, okay? Orgasm is a reflex. It's a combination of psychology, physiology, anatomy that causes a man to release those endorphins in the brain, and is usually associated with ejaculation in a man. You don't necessarily need an orgasm to ejaculate. You have to imagine patients who have to give sperm don't necessarily need to have an orgasm. They just need to give the sperm, and that's an ejaculation. Now, what are the conditions, the medical conditions that can affect your erection and therefore affect your orgasm? The first one is cigarette smoking. You know, if you smoke a cigarette even 30 minutes before the intercourse, your erection is not going to be efficient, right? So, second one is hydration. If you don't drink enough water, you're not going to have enough volume to fill your blood vessels. These are basic, simple things that can be done on a regular basis to ensure you have a good erection. Now, the thing I usually recommend to my patients is to drink on a daily basis drinks that actually heal your blood vessels, fill you up, and help with your hormone balance, okay? Those can have some ginger, cardamom, cloves, cinnamon, and all that. Okay, I make all those. If you need any, just DM me and I can give you some resources. But the key here is to make sure that you stay hydrated. You drink water and you drink some of those natural juices. You cut down on alcohol. Alcohol is another erection killer. You cut down on drugs, another erection killer, and you will see better results. Now, the diseases that are a culprit that are very, very, very common are one, hypertension or high blood pressure is going to affect your blood vessels to the point where you are not able to feel them very well when you want to have a good erection. And the second one is diabetes. Diabetes is worse because not only it affects your blood vessels, it also affects your nerves. So diabetes has more morbidity than just high blood pressure. Sometimes I see patients who, because of their medical conditions, have been taking Viagra or Cialis for a long time, and then at some point it doesn't seem to work anymore. These patients can benefit from the P-shot, right? As you know, I talk about that from time to time. I'm a P-shot provider certified, and what I would do is to give you the PRP, add some Botox and a little bit of hyaluronic acid. I had a patient just a few days ago who was complaining of weak erection by himself. He had to take, and he's only in his early 40s, and he had to take some medication he purchased at the adult drugstore or adult store where you buy all those stuff for adults, right? I'm sure a lot of men understand what I'm talking about. And he was able to maintain an erection with that. But these were the issues. The first issue was that he loses sensation. It's as if he has an anesthetic. You know, he's not able to feel when his wife touches him or, you know, try to do some pleasurable things. He's not able to feel it. He has a loss of sensation. And the second thing is that if he did not time well and the wife was not ready, then he will have, of course, an erection, but it wouldn't be enough time to be active with his wife. Or if he would take too much of the medication, he will maintain such a long erection that it wouldn't be pleasurable for his wife anymore. So he wasn't able to time and make things be natural. And of course, the wife was frustrated. Why? Because he could not have any spontaneous intercourse. Sometimes he said sometimes she really wanted to, and he was like, he was making excuses. I have headaches. Hey, a guy headaches? Have you heard that before? Never. But he got to that point. Why? Because he was smoking so much. He smokes at least 2 packs of cigarettes a day, and cigarette is an erection killer completely. So he came in and we did the P-shot. That was just Friday last week. And right after the procedure, he was already happy because he noticed that the new volume of his organ was larger and longer compared to what he does when he takes double dose of the pill he purchased at the adult store. And like 4 days after the procedure, we just heard from him because I like to get feedback. He is able to have spontaneous intercourse, strong erections, and he's maintaining them. And his wife is more happy because now he can feel what she does with her hands, with her tongue, with her lips. And they are just so much better in their connection, their intimacy, and their orgasms. So I believe the P-shot is something that's beneficial, especially in patients who have damaged blood vessels from either lifestyles such as alcohol, drugs, cigarette smoking, or medical conditions such as diabetes, high blood pressure. Now you have other conditions like psychological. Patients who have depression and are taking antidepressant also tend to have issues with erection. That's totally another issue. But when patients come, I do the education and we figure out what's beneficial for them. I don't guarantee 100% results because there's so many layers into the final outcome. But I believe that considering the P-shot is one step closer to better orgasms, better erection, and a fulfilled sexual intimacy with your wife. Thank you so much for watching. I'm going to add a video of how the P-shot is done, just a short one. And I'll see you next time. Bye.